Alright, so here we are in the part 2 of this video series that I'm doing a little bit. And what I did was I went ahead and imported the afters into Lightroom. So I'm not going to go over that again because you already went over that in the first video. So let's go right into it. So the first thing that I do when I get all these pictures organized, I have a total of about I think 14. So 7, well actually I'm sorry, it's about 16 including the portraits, but since we don't use those on social media because it's just a hassle, we ran into some problems where patients have contacted us and told us to take their face down, and even though they signed a release, we just found it easier not to even go that route. Sometimes they do, but it's just a big hassle to get them to consent, so we don't even bother with that anymore. Okay, so first thing I want to do is put all the befores and afters, the side-by-sides, in order. So what I'm going to do is I'll grab this photo and by the way, I'm in library setting right here, and I'm in the demo too. I can't say the girl's name, so this case was a veneer case that Dr. Pierce did. Turned out really well. The lab that did this work was Frontier Dental Labs with Gil. So yeah, real good company. I enjoy working with them. Okay, so as you can see, we have the photos down here on the bottom, and the first thing I'm going to do is crop the photo. Okay, now I'm not going to do it to all of them because I already went over this in the first video. I want to cut this video down quite a bit. So let's go ahead and make this custom. Oop. 2 to 4 like that, and so it doesn't change. Okay, well. Alright, so we're going to grab this, get it centered up. She's got a bit of a cant in her smile. Now, if this is the final and the patient has a bit of a cant, you can critique or tweak it just like that. Now, what I'm doing is I'm looking down here at the bottom. I'm kind of referencing these two and seeing the creases on the cheeks as they smile, and I'm kind of getting them the same. Now, they don't have to be exactly the same, because you're going to be adjusting them just a hair in Canva, and I'll be showing you how to do that in the next video. Okay, so what we want to do, since we have these colors, the next thing we have to do is match the colors, but I want to go ahead and get all these organized. So this is the after, so I'm going to put that behind the after. I hope you guys are following along. I hope I'm not going too fast for you. So we'll go here. Where's this is the side shot. This is the other side shot. Now, what I like to do is I always like to have the first picture here. It can be facing left or right, but for some reason I think facing the in towards the right looks better, in my opinion. I don't know why. It's just a personal preference. It doesn't really matter what you do. Let's see here. This is going to be this one, and then the money shot, which is the contraster shot. Okay, so let's go ahead and I might speed up this part of the video. I'm not going to go through all these because I don't want to bore everybody what I'm doing here, because it's just repetitive. Alright, but I just want to change this real quick. I just want to make this a little bit ratio. So like I said before, I'm focusing on this bottom one and looking at some landmarks that I can use as a reference to make sure that I have my proportions right in this photo. So I'm going to adjust this like this. And man, look at the angle. The angle is perfect. This is what I would consider a perfect angle. A lot of people will take these photos and they will be slightly maybe too parallel to the posterior teeth, or they might be too close to the midline. So that's a really big problem, or not a problem, but an issue that I deal with on the daily basis, is getting that angle right every single time. Now, you might be saying, hey John, that number 8 looks a little bit gray. And I would say you're correct. If that's the case, now I know that a lot of people will probably say you shouldn't be doing this, but I'm going to say it because it's going to happen. Your teeth, everybody's teeth whether they have veneers or crowns, they're always going to look a little bit different in every single type of light situation that you run into. They're going to look different in the sun. They're going to look different in warm light. They're going to be different using cold light. So neon lights, purple lights, those kind of things. So what I want to do is I want to lighten up this tooth, or actually I want to make it the same color as this tooth. And what I notice is what I'm going to have to do is probably, this is more of like an experiment thing that you have to try. Every person is different because you're manipulating colors, and it's really difficult. And this is not something that I do all the time, so don't think that I'm faking all these photos. But I do alter them a little bit, not too much. So what I'm going to do here in this case, since this is gray, more towards the bluish tint, I'm just going to warm it up. So what I have to do is go to this brush, and then I'm going to go to, let's see, I want to change the color. So what the color is the temperature. Okay. And then what I'm going to do is just highlight it with my marker. That red, what you're seeing, is just a reference. It's not going to be on the actual tooth. And I can turn it off by pressing O on the keyboard, like that. So that just means, like, whenever that's on there, that just shows me what I've already colored, and it keeps me, it lets me know what I've touched up. So I'm gonna turn that off, and then I'll turn up the temperature a little bit and see if I can get it. Now, what I like to do is, looks a lot easier to detect the color difference in this picture right here. I don't know why. It's smaller, and you can see it a lot better. So always use it as a kind of like a reference. Maybe it's using your peripheral vision because it stands out a little bit more. But all right, so I'll turn that off, and I'm going to turn the yellow on and see if I can match the yellow. I didn't do a whole lot there. There it is. So, I mean, maybe that's a little too much. Go back down. So what happens is whenever you edit these photos, you're going to notice that you're going to see your work progress. And when you see these photos live, or you might see them on a TV on different sources, you'll make the small adjustments as needed. So you might think, oh, now it looks okay, like as I'm looking at it, but I might come back tomorrow or the next day and look at it again with a fresh set of eyes, and say, oh, I made it too dark, made it too light. So always keep that in mind. You don't always want to post something right away because your brain plays tricks on you. So, all right. So another thing we need to do. Let's see. I'm not gonna brighten up this or make this tooth more yellow. I think she had an implant there. I think that's why it's dark. But so the next thing that we want to do is match the color to this color. Now you can do the syncing where you hold down the command button, and then click this one, and you can try to sync them. But these were taken at different times. A lot of times people come back with like a tan, or they might have lipstick, and that's going to change all the settings. So it might work. Let's see what it does, and maybe we can get to the right color that we need after I do the syncing. So okay, there we go. Perfect. We got lucky this case. So what you want to do now, since I have these two colors matching up pretty good, this one's a little bit warmer than this one, I can tell. So what I can do is probably maybe make this a little bit colder or make this one warmer. But I don't think I'm going to touch it because I think it makes a good contrasting shot. Now, what some people do, some doctors will do, is have the patient actually wear makeup. So the bigger the difference, the bigger the effect on the viewing audience when they're looking at these photos online. So I want to keep that color, so let's go to this one, and you can do the same thing with this one. Remember, hold the command key down, and we want to sync it and see how this one turns out. Nice. Just what I like to see. All right, so I'm not going to mess with this one. You guys, I just showed you that. These intraorals are a little bit different. All right. Let's go here. 2, 4. Okay, bring this down. like that. And like I said before, I'm basically just trying to size it up and get the proportions right. So, all right. So that's about right. All right. Now what you see, the difference in the color. So what I'm going to do. Oh, and by the way, if you're sizing it up and you've got these, you're looking at this frame, all you got to do is hit enter and it'll crop everything out for you. So you can zoom in like that. Okay, so what I'm going to do here is I think I'll probably just warm it up, and I think I might be able to get a match. But you don't want to go too warm, because what happens is if you have a after case, or these are the after photos, it'll warm the teeth up too, so they'll be yellow. So I'm kind of wondering if I should just cool this down. I'm going to cool this one down, all right? Because those teeth are pretty beat up. And let's see what that does, if that brings down the color that I want. Okay, we're getting closer. Okay. So this is a little bit different. I think maybe I'll just make it a little bit warmer. So my computer's a little bit slow. Yours might be a little bit faster. And I'm aware of that, so I know how fast my computer is. So I know how long it's going to take for it to make an adjustment. Okay, so I got the gum tissue pretty accurate. If the biggest difference I can see is probably down here in the lower, on the mandible. So, but that's okay. You know, what I have is good, because I might be cropping it in anyway. All right, so what I'm going to do is probably take this one and sync it with this one. Now these are the befores, so you gotta make sure that you're not doing this to all of them, because sometimes, even though in this situation it went well, it doesn't always go like that. So do that, let that do its thing. Okay. Alright, so what I'm going to do is just, one more thing. So here's a contrasting shot, and I know a lot of doctors are interested in the contrasting shot. I don't know why. It's a popular shot on Instagram and everywhere else. And it's cool, you know, but it'll fade. There'll be something else later on down the road that people will get excited about. So what we can do... So I did a video a while back on the way contrasters are supposed to be used, and you have to hold the contraster 45 degrees down from the occlusal plane in order to get rid of the glare. What you'll see often is a glare that comes right here from the teeth, because the contraster is too close to the teeth. So you never want this contraster touching the anterior teeth, because you'll get that shine. Okay, this is a matte black, so even the matte black gives a little bit of shine. I'm not going to do it here. If you're wondering what this blue is, that just means it's oversaturation of the black color. So you don't have to worry about that. Now if you bump up the blacks right here, this will bring it down, up or down. So if you want it completely black, totally black, that's you want to actually bring it down. I know it doesn't make sense, but that's what you got to do. Okay, I'm not going to go too much because I don't need to. All right, same thing with this one. So this contrasting shot is going to be different than these intraorals. So they're going to be, you got to think of it as 3 different categories of camera settings that you're going to be doing. You're going to be taking the extraorals right here, which are going to have when you do it auto, it's going to give you a different setting, and it's not going to be the same as the intraorals because there's shadows and things are changing. And the contrasting shot's going to be different because it has a black contraster. So a lot of the colors are going to be deeper. There's going to be much more contrast whenever you're adjusting that. So you always want to adjust the colors and everything. You want to adjust the colors based on the groups of photos. So like these 2 photos, the contrasting group of photo, you want to edit these, and the intraorals are a set of photos, and the extraorals are a set of photos. So always keep that in mind. So this one, I'm going to probably bring it down just a hair. And let's see how long it takes for my computer to adjust. And actually, whenever you're taking these shots in the clinic with the contraster, what's going to happen, at least with the Sony a7 III, it's going to overexpose the teeth. So you have to actually come in here and bring it down. So what I'm going to do is bring this down, the after, just a little bit. See how it makes everything stand out a little bit more? If it's too white, it looks too fake and it doesn't look natural. And besides that, you can't see the detail unless you bring the exposure down. So, all right, so that looks pretty good. So that's basically it. So you want to go ahead and finish up all these, and then in the next video, I'll show you how to export them and upload them to Canva. All right. So by the way, if you are watching this video and you're like, I don't want to do all that work, and you want somebody to do it, just get a hold of me and we can work something out. So until next time, I'll see you in the next video. Make sure you watch the next 2 videos that YouTube puts up because they think that you're going to like them the best. And it's probably going to be the video after this. So take care. I'll see you in the next video.